Okay. Thank you everyone for joining us today. So I'm Jinyan, a moderator of today's talk and also currently a final year Chinese medicine student at IMU University. So Miss Dennis is also our tutor from the IMU University Chinese medicine department. So we are from the IMU University School of Alternative and Complementary Medicine and Chinese medicine program and also department. And our speakers here, we are very excited to say that thank you for Miss Jia Ying and also Mr. Yao Yong for joining us today and have a sharing of your experiences in Australia and also China. And Miss Jia Ying is also a graduate from IMU and she did her training in RMIT and is also a CM practitioner in Australia currently. And Mr. Yao Yong is a graduate from IMU University and also went to Shanghai for a master's degree. And two of our speakers will be sharing their thoughts on today's talk on the program recognition on both local and international market. And the housekeeping rules, please keep in mind that we have muted all of the microphones for all attendees, and also from the question and feedback, please use the Q&A panel, and this live webinar will be recorded. And let's move on to the next one. So I will be passing on to Miss Dennis, our tutor of IMU University Chinese Medicine Department.
Thank you, Jenyan, so much. And thank you everyone for joining us this evening. If you are from Malaysia and particularly in KL, I hope you are, well, nicely away from the heavy rain we have experienced today and already had your dinner and, at home. And if you are from overseas, we really appreciate, you joining us with the time differences. Just to give you a brief overview of our current partner universities with IMU Chinese Medicine program. We have Shandong University and Shanghai University. And today we have the great pleasure of hearing the Shanghai University with Jeff, also Yao Yong. So, you will hear some real life experiences from him. And Jia Ying was actually our graduate from here, and she moved to Australia in Melbourne. Currently, we're in the midst of exploring partner universities for Australia as well. Jia Ying, can you move to the next slide, please? So, we already mentioned that we introduced so we got two lovely alumni, one who is based in Melbourne and the other one in China. So you get an overview of both countries. And then we have our moderator, Jin Yan, and you'll get to hear her personal experience as well in the local market. Next slide, please. So perhaps we could start this evening with why did our students here choose Chinese medicine, particularly IMU? I would say, Jia Ying, do you want to go ahead and answer that first?
Yeah. So for me, I chose IMU because IMU offer like a English teaching compared to other university in Malaysia. IMU actually teach mainly in English. So, and also they offer the twinning program with other uni from China and also Australia. That's why I chose IMU, yeah.
And just to let everybody know, IMU is in Kuala Lumpur. And Jia Ying, where are you from originally? Are you from Kuala Lumpur or did you move?
No, I'm actually from Sarawak.
Wow.
Yeah, the east part of Malaysia.
Yeah, fantastic. Yao Yong, do you want to answer this for us?
Okay, so why I chose IMU? To be honest, to say is because my sibling, they are choosing IMU to pursue their degree course. So I just following them, but we choose different program. Okay, get back to the questions, why I choose Chinese medicine program. So actually, there have a lot of people ask me this kind of questions. So believe me, when you really choose this course, on the first day, when you're at the IMU campus, get ready your answer. So you can prepare different answers like your parents force you to study, or you're smart enough to get the full scholarship So IMU force you to study. So, but for me, I would like to say the first thing that come up from my mind is easy. So why I say like this? So that have something to prove it. The requirements of study Chinese medicine is quite low. If I'm not mistaken, CGPA 2.5 or not more than 3. But right now, I find out that I was wrong. Not easy at all. So for newbies, for someone that haven't stepped in, yours still can run. Apart of thinking easy, I have a lot of reason that pushing me choosing this course. I believe that everyone are unique. We have different thinking, different hobby. So ask yourself what you want to be. Find out your ability. For me, I like to communicate with people. I find out helping people that make me happy. So I like Chinese novels a lot since I was standard 2 or 3. Even right now, I'm still reading. So all of kind of these reasons that make me choosing this course. So I hope I have answered your question.
That's wonderful. I think that was quite extensive, and it's very personal as well. And I really appreciate you sharing that personal experience. And are you from Kuala Lumpur, I believe, or somewhere else as
Yes,
well?
I'm there. Yeah, I
Okay.
stay KL.
Yeah. And none of your siblings actually chose Chinese medicine, only you.
No, only me.
Yeah, that's fantastic. And you did share that you're now in China. Was this plan like throughout your 4 to 5 years here for under the undergrad? Did you plan to do your master's after, or did you plan only like maybe later on?
Actually, I didn't plan for master. I mean, at beginning, after graduate, just like normal people, just go outside and work. But I mean, when you work, then you will like face some questions like how to treat the patients. Like sometimes you treat like on sometimes like, I mean, it's not cure. I mean, maybe the treatments are not good enough, but you can't ask someone, because you work with your own. So that's why I plan to having a master to further study. I mean, especially in China, have a lot of department actually can go and observe and go and see how they treat the disease, another treatment method, something like that. Yeah.
That's fantastic. Yeah, thank you. Perhaps you can go to the next question. So what are the advantages have you experienced overseas as a Chinese medicine student from Malaysia? Jiang, do you want to answer that? Your experience in Australia, how do you feel about this?
Yeah. So because we learn different languages in Malaysia, so you can speak English, you can speak Mandarin, and we don't use a lot of Malay in Australia, but if you know how to speak Mandarin and English, if you know how to speak Mandarin and you study Chinese medicine, it's a bonus. But if you don't, that's okay. But as a Malaysian student studying Chinese medicine in Australia, I would say you get a lot of benefits, like the lecturer take care of you well because they know we are from overseas and they know we're away from home. So yeah, you get a lot of not attention, but yeah, the lecturer take care of you. And if you're looking for any part-time job in Malaysia, as a Malaysian, we have a good reputation in the working sector. Yeah, I don't know why, but they do like to recruit Malaysian to work. No matter in a restaurant or cafe or anywhere else, they like Malaysian. Yeah, that's my experience.
Yeah, that's wonderful to hear that they embrace you with open hands as a local student, and when you get over there, you feel warm and welcome. And you mentioned that in particular, they appreciate that you are dual language. And I think a lot of people here have questions about, because it's Chinese medicine and, mainly taught in or understood in Mandarin. And because in IMU, we teach it in English, do you find that there is a certain barrier with that when you are in Australia, or is it, the same? How does it, changed both ways?
I think it's about the same. So when I was studying in IMU, the lecturer kind of teach it in both languages, if that makes sense. So they make the slide in Mandarin and also English. So yeah, that kind of make it easier. And also because I further my study in Australia and we use English for the whole course. Yeah, some of the teacher they don't speak Mandarin, so they teach in English. So that's very helpful.
Yeah, also considering that when you actually see a patient over there, they speak mainly, in their own languages as well. So, that is kind of understood. Well, thank you for sharing that. Yao Yong, do you want to share your experience?
Same as Jiaying, the advantage that I found out is language as well. So IMU teaching method use English. So I remember that to pursue my master's study, I need to select my supervisor. Of course, not only you have the right to select your supervisor also have the right to reject you. So we need to undergo an interview. So the first question that my supervisor asked for is to introduce myself in English form. So right? Sometimes people need you sure that you have something that needed. So I can help my supervisor to translate some research papers and so on. Of course, my English is not well. You can see compared to Jiaying, she speak well even with the slang. I'm quite jealous. Okay. The other advantage that I found out as a Chinese medicine student from Malaysia is to build up my confidential. Some things that different study in local and abroad, study in China, is during the practical time. In IMU, we have our own Chinese medicine clinic. So during year 5, you can handle your patients with your own. I still remember that the last semester in IMU, if I'm not mistaken, we need to complete 6 mini CX. So mini CX means that we need to prepare our patients, real patient, not an actor, and then we select our supervisor. So 3 of us in the consult room. Our supervisor normally will sit behind and keep quiet, just observe how you handle the patient. So how you communicate with the patient, how you ask the patient in the proper ways, how you diagnose, what diagnosis you give. So what treatment you plan to prescribe to your patient. At the end, your supervisor will point out what is your mistake. Of course, if you do something well, they will praise you. So don't be afraid of making mistake because you are just a student. You are still forgivable. So I'm glad that during that time I had made some mistake. The things that different in China is that they won't let you handle the patient with your own. The things that you only can do is just observe. So imagine that after you spend period of time to observe, after you graduate, so do you dare enough to manage a patient with your own? So let's say if you are there enough, but will you do wrong? Unfortunately, you are not student anymore. So no one will stay beside you to point out what mistake you done. So I built up my confidentials during that time. I find out better ways to communicate to the patient. So in reality, they have different kind of patient. Not everyone's polite and kind. Some of them are rude. They'll even bully you because you look young. So how to communicate with them to calm them down? So in other conditions, after you apply needles, acupunctures on the patients, after a few minutes, the patient fainting down. So what step you're going to do? Another example. So how long to retain the cupping on the patient body? So if you're putting too long, it might grow blister. So what step you are going to do to manage the blister? So what I'm going to point it out is there's a lot of conditions that might happen that not listed in the textbook. So practical really grow me a lot. Yes, that's all.
That's wonderful. Do you see, because you mentioned that you've worked quite some time or so in KL, and then you went to do your master's, do you see different conditions as well? so you can make a comparison, or the climate is different, everything is an environment. And
I can see sometimes there are, as my supervisor says, I mean, you can study and just, I mean, see how was their treatment, how they prescribe herbs, but you can't bring like all along to back to China, back to Malaysia, because I mean, in China there are 4 seasons. Sometimes like different season they use different herbs. I mean, Malaysia's there are only hot climates, something like that. So you can't bring like all the medicines, like just copy and paste. So you need to make some changes. And he also like encouraged me to find out like what herbs in Malaysia. So I mean, Malaysia's we have also herbal herbs. So how to like combine together and use it, something like that. Yeah.
yeah, so with different formulas to suit the climate, and then depending on, like, I guess the supply here and then the supply there as well. It's very fascinating. Thank you so much for sharing that. Perhaps we can go to the next question. So what advice would you give to future students interested to study abroad or locally? Yeah, because both of you have been here and then also been overseas as well. So Jia, perhaps you could go first and share this.
Yeah. Okay. I would say just keep your mind open and explore your passion. So take some time to explore your interests, your passions, in both inside and outside the classroom, so you know what you want, what your interest is, and they can help you to discover your strengths and your aspiration. And just believe in yourself. You can do anything if you want to do it. So just believe in yourself. You are capable of doing anything if you want to do it. That's yeah.
Thank you for sharing that. Have you, how was it, the transition when you got over from here to Malaysia to Australia? Maybe you could share a bit about that experience, that transition during that time. What have you experienced? And then having that open heart and an open mind, that really cultivate, more opportunities for you as well.
Yeah. So I came to Melbourne with another 2 of my friends. So you have someone to take care of and to move along with you. So that wasn't too bad, but that was during lockdown. So a week before lockdown, a really bad timing, but at least you have someone with you together. And so we spend most of the time indoor, everything is online. We couldn't meet most of the classmates or even our lecturer for about 1.5 to 2 years. That was really, really bad. But then at the end of the lockdown, we're slowly going back to classes, so we get to meet our classmates and our lecturer. So half of our classmates, they were Caucasian only, and half of them they're Asian. So it's very interesting to see someone who doesn't speak Mandarin to study Chinese medicine, but it's really amazing and fascinating how they even study better than us. So yeah, you can do anything if you want to do it. So just although you have some language barrier, because when we first came there, our English is not that great, but we still practice to talk to your classmates, share your experiences as an overseas student, and yeah, exchange interests. We go out for some coffee. Melbourne is really famous for their coffee. I don't know why, but I don't really drink coffee, but they have the best, maybe one of the best coffee in the world. Yeah. And yeah, after lockdown, you can go out And Melbourne has a really good culture of art culture, and I think they do a lot of music festival, anything artistic. Yeah. So, yeah, that's all from me.
Thank you for sharing that. Yeah, I know, well, just to share a bit my own personal experience with Jiaying as well. We were both in Victoria, Melbourne together. But my experience is slightly different. But Victoria, Melbourne did have one of the strictest lockdown in the entire world. It was 5 kilometers radius for a long, long, long time. And I do empathize, the online studying, it was just very, very contained. But having that embracing, that open-heartedness and learning, with that kind of attitude, very positive. So thank you for sharing that. Yao Yong, what advice would you give to these future students?
To be honest to say, if you want to build up yourself, then I recommend staying local to complete your degree. So if you want easy life, then study abroad. So why I say study abroad will be easy? So first of all, you need to know that when we as a foreign student study at China, we are not study with the local people. They actually have two separate class. So one class is for local China student, then another one is for foreign student. So imagine that foreign student, they come from different places, some from Japan, Korean, Africa, Thailand, our countries, and so on. So the point is, the teaching method is using Chinese. So do you all know that Chinese actually is the most difficult language to learn in the world? So right now, you can have a picture to imagine how hard they will give the test in Chinese for foreign student. Of course, what I say is from my standpoint. It might has bias, so I hope this can be a reference for you. So to summarize, the advice that I want to give, I prefer to complete the degree in local. So after you graduate, you can spend some time to China to observe and learn. There have a lot of our students after completed their degree in IMU that at least spend half a year at the China hospital. Just like Western doctor, they have housemen, the same things as Chinese physicians. So we have a lot of departments like gynecology, urology, traumatology, oncology, and so on. So to build up fundamental, IMU is enough. But if you want to explore more, to enhance your skill and knowledge, so then overseas is one of the best choice. Yeah.
That's fantastic. Thank you for sharing that. It's interesting to hear, there is a separate, teaching of the local and international. Do you get to mix with both local and international as well, or that's segregated? Do you come together and then learn maybe in a hospital setting, the residents, or?
No, normally they separate into two classes. I would like to say that local student, their standard will be much higher and harder compared to like foreign student. Yeah.
Wow, that's amazing. And how long is the master's course that you're on? Is it different from everyone, or it's just
Same as China students, also 3 years. Yeah.
3 years? Yeah. And I don't think you did mention what is your specialty with this master's?
I'm master in on urology and oncology.
Wow. Yeah. That might be big words for future or new students here wanting to join us, but this is probably 6 to 7 years down the road of where you can see yourself. So it's quite interesting. And we have heard Jiaying spoke about her Melbourne experience, and then thank you, Yao Yong, for sharing your experience in Shanghai. Maybe we can move on to more, because we are looking at a foreign and also local, reputation of IMU Chinese medicine student. So Jenyan, I know you're the moderator for this evening, but could you also share, because I think you're third year, going to fourth year, a student in IMU. How is your local experience as a IMU student?
So actually, because IMU University provides a very comprehensive practical sessions and also workshops, and also we also have IMU Chinese medicine clinic at the lower ground floor. So actually, it is a very good chance for us to like practice on our own with the supervisors along our sites, and also they can guide us along the way. Because actually, throughout the 5 years in IMU, actually, because there are like more opportunities like having CSD session, which is clinical skills development sessions for Western medicine and also Chinese medicine. So it not only enhance our skills in the Chinese medicine, we can also like get exposure to those Western medicine skills and techniques like auscultation and using stethoscope for those kind of hearing of the murmur of the lungs and also those kind of heart sounds. And this kind of comprehensive curriculum does help with the students in preparing us in graduating in the future and become more competent as a healthcare professional, either in local or international. So it's like the experience is like a very strong experience because we also get to have exposure to all those medical outreaches and also charity clinics outside. So actually we have a lot of opportunities to help train our skills and also help deepen our knowledge, not only on textbooks and classrooms, we also get to expand our horizons to outside worlds, like and more of a practical kind of knowledge, and also help us prepare better as a student and also in the future for a better career, and also help us like gain more confidence in our skills and also our knowledge, which it is very important because we get to communicate with patients a lot in the future too. So it's like a win-win situation for the students also.
That's
And
fantastic.
yeah.
Yeah. Sorry, go ahead and share.
Yeah, I remember my first training session outside, which was at the Sea Fertility TCM Center. It was a couple months ago, it's like 6 months ago, where Mr. Dennis introduced me to Mr. Anthony, and Mr. Dennis actually brought me to this kind of exposure to outside clinics because I did not know where to find anyone to help me communicate with the clinician outside. So Mr. Dennis actually recognized Mr. Anthony, which is one of the founder of Sea Fertility Center, which is a very famous and also very known fertility center to help cure fertility issues in either man or female in Malaysia, actually. And this one is a very fruitful experience because I was following Mr. Anthony throughout the sessions. I went for quite a couple of months, but I stopped now because I'm starting my semester, and this semester was quite a bit of a burden semester, so I stopped going outside because we also have clinical attachments on Saturdays and also on weekdays currently. So I had the chance to like follow Mr. Anthony, like observe first in the first like 5 sessions, and he allowed me to like put acupuncture needles on his patient with the patient's consent, and also getting those kind of confidentiality and also keeping it private in our conversation. So I also had the chance to like put acupuncture needles on them. It's like it helps me to like know where the point exactly is, and also help enhance like not only a basic internal medicine case but also a endocrinology case. It was a diabetic man who was having diabetes for a uncontrolled diabetes for like 20 years, and he did not want any medication. So it was like a very fruitful experience because I never encountered this kind of case before in my life, and it was one of the most memorable case when I was with Mr. Anthony at the Sea Fertility Center.
Wow, that's great for you to share. Thank you so much. But yeah, I think it was just a very easy connection for me. You were very interested in seeing some another practitioner outside, and you had some time during the break, and I was like, oh, why don't you just go observe? Yeah, it's wonderful to hear that you grew so much and learn locally, and I guess he's also recognized that you're an IMU student, so he was happy to take you because I believe in some sense IMU students have a certain standards, if I could say that. I'm not quite sure whether Jiaying or Yao Yong, have you had a similar experience? Because I think Jiaying, you went over halfway through the program. And then for Yao Yong, you went over after the full program. So, Jiaying, did you get a chance to work in or any shadow locally in Malaysia, any clinic at all?
Not really, except the clinical attachment in Tongsan Hospital. That's it. Yeah.
Yeah. And how was the experience for you, going there as an IMU student?
It was really great. Yeah. We follow a few of the should I call them doctor or practitioner around to see clients, to see patients, and then mostly they speak Mandarin. So is it Mandarin or English? Mandarin, yes, yeah. Yeah, but it was a good experience. Yeah, you're able to see a Chinese medicine doctor in a hospital setting instead of a clinical setting. So that's very fascinating.
Yeah, thank you for that. Tongshin, for everyone here, Tongshin is one of our, I guess, attached hospitals that we have students go over to experience, and it's wonderful to learn over there. They have an entire stroke unit, which is great, for acupuncture and physio, and for us to learn and oversee. Yao Yong, how about you? When you were studying here in IMU, did you get this kind of experience as well?
I think all of us is the same. We go attached to see fertility, to Tongshin, and so on. Yeah.
And were the
But right now, I don't
practitioners?
know.
Sorry?
Sorry for interrupt.
Oh,
But
no,
right
it's
now, I
okay.
don't know. Do they have add on some new attachment, some places?
Yeah, over the years, I guess there are new clinics, and then we have other clinics that, with our graduate program, and then have more industry partners come and join us as well. So we send students over there. So hopefully we get to see more. Maybe we're just waiting for someone, 3 of you to graduate and have your own space, eventually, and then you can have our students as well. And I think it's quite, this is the future. You guys are the future for Chinese medicine. So, you pave the way for clinics and you pave the way for students. So this kind of cycle has to continue. But it's wonderful to hear that, the clinicians outside and the practitioners are happy to embrace IMU students. And then let's just see. What are the next questions? Oh, so I guess this is our time for the attendees to ask questions. We do have a couple of questions here I can perhaps help answer, and perhaps also have our alumni answer. So I guess the first one could be, we are getting quite a few here about speaking Mandarin. Do you need to understand and speak Mandarin to be good in Chinese medicine? Jiaying, do you want to answer that, perhaps? Do you need to understand and speak Mandarin to be good in Chinese medicine?
No, not necessarily. Like I shared before, half of our classmates in Australia, RMIT in Melbourne, they are Caucasian, so they don't necessarily speak Mandarin, and they can't understand Mandarin as well, but they still do really good in Chinese medicine.
Yeah, thank you. I think that's a great experience. And I just want to share also, Chinese medicine is actually taught in any language that you can think of in the world. It's taught in Portuguese, it's taught in German, it's taught in many languages. I can't think of right now, but I do have overseas colleagues who are multilingual, and it's beautiful to see them speak and understand our beautiful medicine in their own ways. So yes, Mandarin is not a barrier. In fact, I think if you have that understanding, it will enhance you, but it's not one of the limitations. The next question that I could probably say is, what are your challenges while studying Chinese medicine? Chen, maybe you can answer that because you're still in, one of our current students here. So any challenges that you're facing studying?
Challenges, actually the biggest challenges
Whoops, Jenyan, I think you're cutting off a little bit there. Jiaying, could you hear her or anyone here? I cannot really hear her as well.
manage your financial, or is it, can you hear me?
You're slowly coming back. All right. I think we've lost her there.
Hello?
Sorry for the technical issue.
Oops.
Yeah. That's okay. We can just slowly move on to the next question. Yao, maybe this is for you. How's the job opportunity in China overseas?
So I think the same things in China and overseas as well. If you're gonna to work overseas, so you need to apply, need to get their license. So different country they have different requirement. In China, if you want to apply their license, at least need to stay at hospital. The Chinese medicine hospitals, stay for 1 year. After that, only you have, you have the you have the requirement to apply the test to get the license. But if you fail it, then maybe you need to stay another 1 year over there. Yeah. So actually it's not easy if you want to get the license in China.
Yeah, and when you were here after you graduate, was it easy for you to find a Chinese medicine practice job, or was it challenging?
Sorry, I can't hear you.
Sorry, I'm not sure whether you hear me now. When you finish graduating, when you finish studying here, one of the
Yes.
questions that people are asking is also, was it easy for you to find a job locally in Malaysia?
Because you are fresh grad, actually, if you want to find a job, it's actually easy, but don't think that the pay will be higher. Okay, if you find job is actually okay. Yeah.
I guess it's easy for you to find a job. It's just that the pay was a bit hard, and yeah, like any other career growth, I guess, it was kind of hard to do that. But I think a lot of questions here from the participants are, you're worried. I can see that everyone's a bit worried or concerned about the career prospect of a Chinese medicine. And I can assure you that you work hard, you get a lot of opportunities, because as you can hear from 3 of our students and alumni here, that when you get the opportunity, you get a firsthand. For Jen Yan, she's really observing, and when you observe, you already know the owners and the practitioners there, so you really have a contact, a connection. So more likely of you building your contact while you're studying, and then eventually graduating into somewhere that who already know you. So I think that is a valuable experience as well. So even when you're studying here, have an open heart, an open mind, have that experience as well. Let's see, maybe you can answer one more questions. Let's see. I think there's also some questions about the requirements of getting into our program. I'll refer you back to coming to our university or emailing us. We will provide you information about our program, and you can, write to us about, your concerns about the intake and what level of your grades, and also encourage you to come for our open day and our educational fair that we have throughout the year. We are always very happy to answer any questions through email, or even with our marketing department in IMU, everyone's very happy to accommodate, or even for you to drop by the university if you're nearby to come and see our campus. We can bring you around the clinic, and I'm sure you will have the full experience of seeing our university, and even perhaps speaking to our program directors and some of our senior lecturers as well that have been with us for many years, and also hear their experience, because some of them are also alumni. And perhaps, Jenny, you can move to the next slide. I'll just wrap this up with everyone as well. So yeah, today is the 18th of April that we have this session talking about our program recognition in local and international market. The next session is the Masters in Acupuncture, perhaps a little bit further for everyone to think of, but we do have our own Masters Acupuncture program in IMU. So we have Prof. Zhou and Dr. Charles who will speak about the program. So you can join us for that to understand more as well. And then on the 13th of August, we have Ms. Goh and Mr. Seng, who were alumni of, who were students of IMU Chinese Medicine. And then, you know, I think Ms. Goh, like Yao Yong, went to Shanghai University, and Mr. Seng is also pursuing his PhD right now. So I think there are really valuable experience that you could talk to the individual lecturers that everyone's very interested in. So I'll perhaps pass this over to Jen Yen to wrap this up. Thank you so much.
If like what Ms. Dennis mentioned just now, so if anyone is interested in joining our future talks, please do join, and also you will be finding out many other interesting things of Chinese medicine, like acupuncture, and also other future prospect of CM. And let's wrap up our talk today. So please, you'll be finding us on Facebook, Instagram, and also LinkedIn. And thank you everyone for joining. Really, thank you so much for your participation, and also thank you Miss Dennis, Miss Jiang, and also Mr. Yao Yong today for our speaker. And thank you for the interesting sharing, and also we hope to see you all soon, very soon, in the future talks, and also we'll be seeing you around campus, hopefully in the future. And also, yeah.